All right, we're live.
All right.
All right. So let me change this here so I can see any chat comments here. Hey, this is Jasmine. I am hosting the Empowerment Series with the Inspire the Future Summit, and I have a very special guest, my former professor, Miss Marion Manski. Thank you so much for coming on the series. So for anyone that doesn't know this powerhouse, she is an associate professor and director at Fones School of Dental Hygiene, University of Bridgeport. She earned her certificate and associate's degree in 1983 from the Forsyth School for Dental Hygienists and Northeastern University in Boston, Massachusetts. She earned her bachelor's of science degree in dental hygiene at the University of Maryland School of Dentistry in 1988. Woo woo! That's right. She also graduated from the University of Maryland Graduate School with the Master's of Science degree in 2004. She is an associate professor and serves as the director of the program. She has a lot of amazing credentials here. She's involved in administration, curriculum, academic advising, overseeing the program's strategic plan and goals. What's really awesome is that she's had some great leadership roles and experiences, such as being a part of the School of Medicine from University of Maryland, Jacques Initiative Preparing the Future Task Group, which is an interprofessional initiative to educate students on normalizing testing of HIV. She's also the first course director and coordinator of the local anesthesia. She was huge in helping us get that in Maryland. I'm not there anymore, but I'm still saying us.
I thought too.
She taught me with that. She was recognized as a mover and shaker in 2016 with Dimensions of Dental Hygiene's annual 6th Dental Hygienists You Want to Know. She's also previous president of MDHA. She's a rock star clinician and educator, and I'm so thankful to have her here. So welcome.
Thank you. Glad to be here.
Yes. So you are now in Connecticut. I went to, for those that are watching, I went there for my graduate program and loved it.
Right.
Absolutely. It is. And it's funny because that was my third program I tried.
Yeah.
And I don't know if you remember because you gave me referrals for like maybe one or two of them beforehand.
Yeah, I do remember.
And then I started with that program. Excellent program. So I think with a graduate program online, they have a baccalaureate degree online. They also have the entry level that you can come in. I think a great topic for us to talk about with your experiences is mentorship.
Okay.
And how that can help support the new faculty member or even someone that may be seasoned and coming new into a program. So what kind of role did mentorship play in your professional journey in academia?
Oh, in academia, huge. It was huge. I mean, I was lucky enough to have mentors that were rock stars to begin with. I had Linda DeVore Rubenstein, who was amazing, Linda Rubenstein DeVore, and Jackie Freed, who was like rock stars in their own element. And so when I came there at Maryland, I was a degree completion student, and I had my AS degree from a great hygiene program in Boston, Forsyth. But I never was a thinker. I didn't think I could think. I had to do what the dentist tells me to do. And so when I went to that program, it's like I had Jackie and I had Linda saying, you could think about this and you can go back to your practice and suggest it with the evidence-based decision-making that you have. And I'm like, wow, really? So it kind of opened my eyes to the power of education, the power of learning, and learning from them. And they were my role models and my mentors. And when I went on for my master's degree at Maryland, sure enough, I went to Linda and I said, oh, I like this topic. And Linda, of course, being the wonderful person that she was, said, well, then you're going to do this, Marion. I'm like, yeah, okay. And then she's like, and you really need to get involved in the Hygiene Association. I'm like, really? What? So she basically was there to kind of give me a little push, maybe sometimes a shove, and the mentorship was fantastic. So I felt like I had to do that for people after me, because I had such great mentoring. And even when I became director, Jackie Freed was director prior to me, and she was still there, and she was my mentor. and she still is. And I can always go to her. I can laugh, I could cry, I could shut the door, I could talk to her, and it was so wonderful. So I try to do that with people that I see in my program, in the programs and degree completion program and the master's program here at Maryland. And I see that there's something special about that person they don't realize. And I sort of say, hey, you know what, you should try to do, or how about this, or let's work with this. And the next thing you know, they're taking off. So, you know, you see a leader in the making and you want to groom them. You don't want them to go away, because, you know, the association we need leaders, and we need people to be involved. And it's hard. It's hard these days because we're all so busy with our families and our professions. So mentorship is a big thing for me. I really do love mentoring. I mean, I have a degree completion student right now that I'm mentoring, and I know it's made her think about going into the graduate program, which is great. So I could just see her blossoming from when I had her first last spring. She was my TA, and now she's faculty, and now I know she's going to go on for that master's degree. So I'm so excited just to see her come out and be so excited to be a teacher, you know.
Yeah, yeah. I think the hardest thing for when you're a student is just to understand what your potential is. You have so many things being thrown at you,
Right,
so
right,
many rules and regulations, and
right,
trying to
right.
handle that load. And it does help, and it helps tremendously. Even if you're a faculty member and someone is willing to help you along the way, it makes.
Exactly. Yeah, I mean, even for me moving, you know, coming to a new school, and I was not director till this year. I was a clinic supervisor, second year supervisor, and I didn't know the school. All their policies were different, and but I had mentorship too. So from the other end, coming from where I came from, they're all like looking to me, and I'm looking to them. So I had some great mentorship there, which is great. And so it just worked out quite well that I'm now the director. And doing much more than I did at Maryland. I mean, it's different when you're not housed in a dental school. So different. And I only knew that being housed in a dental school. So to me, my chairman would take care of the things. Now that I'm responsible for everything from top to bottom of that program.
Oh,
So from
there was a clear difference.
Oh yeah, a big difference, because you've got the staff, you've got the facility, you've got the faculty, you've got the students, you've got the administration, you've got everything. And when I was at Maryland, I was Division of Dental Hygiene, and my chairman took care of all that. So I focused on curriculum.
Mhm.
So I'm happy that I have an associate director that we deal with curriculum and stuff together. But yeah, it's very different. I mean, it's running a business. It truly is running a business. And at Maryland, I was just in the department. I was not running the department. I ran my division of dental hygiene. This is a school. This is it, you know. And I report to the dean, who's fantastic, who's a great mentor also. I mean, I just can't believe how wonderful she is. And she's pretty new to her position. So it's great to have her there, and she's learning too. So all new. And sometimes I'm like, what am I doing today? You know, but then I'm like, you know what? There's a reason for all this, and it'll show itself. So it's all good.
So how do you prepare? Because I mean, you think about your journey and where you've been so far. Like, how do you prepare to step into a leadership role like what you're describing?
How do you prepare? You have to go for more schooling. I'm sorry. You got to get that graduate degree. And I mean, I think even at this point, for someone that's much younger than me, I know they're all going to go on to their doctorate degrees. And I think that's fantastic. But when I was, in my 30s and 40s, it was get that master's degree. The value of the graduate degree really helped me as a jumping board, jump off of that to something else, because there are a lot of things that you had to learn to deal with that was perfect for teaching, perfect for mentoring. So I think that having all that knowledge and the effort that it took to do that thesis and put it forward and then start publishing and networking with all these people that are in the same boat as you. Again, being a member of your association, for me, the ADHA and ADEA, American Dental Education Association, is so valuable to me, because I meet people, like-minded people, who are in the same exact boat, and we we feed back with each other and really help each other. You know, if I have a question, I'll email somebody. They'll email me. Do you know someone that can do this? Yeah, I do. So it's that networking, mentoring, just letting yourself go onto waters that you didn't think you would go into. I mean, you talked to me when I was in my hygiene program. I was going to go practice and maybe eventually get a bachelor's degree, but I didn't think of anything like this.
Yeah.
So it's gone a lot. And being on the campus and opportunities that presented themselves, and was like, yeah, I'd like to get involved in that. You know, interprofessional education is big for me. Local anesthesia, that was a whole thing in itself, because it wasn't even passed yet in Maryland. And I said to my chairman, may I go to Connecticut to take the course because it passed in that state, and I can bring it back to Maryland and maybe just do it in a clinical situation before the law passes. And I was able to do that with his, good graces and blessing, I guess, and my director, which was Jackie. And then the board of dental examiners in Maryland allowed me to do that, which was like, what? Wow. So we took off on it. And so when the law passed, I knew all about how to do the curriculum. I had it in place. I had everything in place. And it was just like, I'm ready to push play. Here we go. So it was really wonderful for me. And I also learned so much from taking on an expansion of scope. Did I ever think I'd be injecting patients? I didn't think anything would ever happen, and here I am teaching thousands of dental hygienists how to administer local anesthesia, also teach them how to do nitrous oxide. I mean, just amazing. And now up here, we're the first school that's teaching laser clinically to our students, making them do a competency on it. They're required, and they're using it on patients after the competency is done. So yet another expansion of scope. I think that's what my favorite thing is expansion of scope, because that and interprofessional education to me is also an expansion of scope too. It's exciting. It's fun. It keeps me going. I mean, I think when hygienists said, oh, I should have picked a different profession. Why did I go into this? Well, what are you doing with it?
Yes.
What is it you're doing? Well, I work in a practice and I don't really go to CE and I'm not part of my association. I'm like, well, you're in a dead end zone. No wonder why you're not enjoying it. You take this to the nth degree and do what you want with it. That's what's great about this. And that's what I think I really like about this profession in academia. You can take it to where you want to take it if time lets you do it. Sometimes right now my time is crazy because we have accreditation. But I still have my contacts. We're still doing things. We want to do things now. We got dental therapy that passed in the state. My colleagues, and we just went to Minnesota. We checked that out. And we met, the director of the Metropolitan State Program, who was like amazing at what she's doing. So it's like another avenue. So there's always something happening if you want it to. Otherwise, when I hear that stuff, I don't know why I chose this. I'm like, what? What do you mean? What do you mean? I love it. I love my profession.
I was talking with someone, and I said to them, this is the best time to be a dental hygienist.
And great.
This is the best time. They're like, well, why would you say that? And I said, well, a lot of it has to do with the people I'm surrounding myself with. Right. And everyone is that's another topic I want to talk about, was just innovation. Everyone is forward thinkers. They're about taking action. Like, how do you keep the innovation at the forefront, especially when you're dealing with the confines of the rules and regulations for your state? For instance, here in North Carolina that I'm living in, there's no local anesthesia at all.
I know. Oh my gosh.
My favorite thing is to teach local anesthesia and to inject as well. I love it, right?
You can't do either one. You can't do anything down there.
No, when you look at that circle where it shows like all the things people can do, North Carolina is completely like, there's no supervision. They just actually passed something that had to do with
they can go out and treat patients without the doctor present, elder and nursing homes, and I think schools. In a limited capacity.
Yes.
So they're sort of finally getting general supervision in North Carolina, which has UNC, the most prestigious research school of dentistry, and a great dental hygiene program. Frustration is all I can say.
Yeah, very, very conservative. And so I think a lot of the hygienists who are from this state, and that's all they know, it just seems like, oh, you know?
Yeah,
How do
it's
you keep
unfortunate.
that? I know it is, it is. And I've had a taste of it, which is
Yeah.
great, you know? How do you keep that innovation at the forefront, especially when you're working? We also have to deal with some admin things, you know? You
Mhm.
you can't make decisions like this.
Oh,
Like
I know. That
you
makes me crazy.
right.
I think I have to, I mean, I guess the fight again. Here we go. You know, you got to get involved yet again in another legislative situation. Your association needs to be active. They need to find the champion in the legislature, and they need to work hard. I mean, they can't be silent. That I don't know what the climate is of the association and activity. I don't know. I'm not sure what's going on in your state, but I think when Maryland decided, I think we found a wonderful lobbyist when we had our Sandy Schrader, who was a former senator of Maryland. She just really let us take off. We took off because she had the connections and she found what worked for us and who was going to be that champion. And still to this day, we have that champion in Maryland. You know, Delegate Kipke, he's fantastic.
Mhm.
Delegate Krebs. But you know, I moved to a different state and I got to find them all over again. You know, I don't know that territory that well yet. I'm involved, but I knew exactly who to talk to in Maryland. I knew exactly. Here, I kind of know, you know, but not as well as I knew in Maryland. So I think that activity has to be, you know, you got to get working down there. I mean, Texas is the same thing. The frustration I hear coming out of these states, I don't know how to get past it sometimes. I just think you got to fight the fight and get those little baby steps like we did in Maryland, you know. Uh,
Right.
Here, there's no nitrous oxide. Makes me crazy. Like, what do you mean there's no nitrous oxide? We got to have that because we're treating children. We're going to go into dental therapy. I mean, really? But it's all very slow and very different. Uh, I just don't give up. I mean, but that's what has to happen in these states. We can't give up. We have to be active in our profession because otherwise it's just like, you know, check in, check out, punch in, punch out. Duh, that's it. Nothing's going to change.
That
It's
is
hard though. Some states it's very frustrating.
yeah, yeah. So how would you say, I mean, I'm just thinking about all of the work right now with phones that I've seen that has changed, like with the CE courses that you're offering and
Right.
um, you guys put on a student board review and you invite, you know, the people that are practicing to come in and get CE. I mean, all these wonderful things to kind of keep up and
Yeah.
keep fresh.
Yeah,
Um,
we do that every year. We do a board review, which is well attended, and we ask people from different schools. There are some that are Fones faculty also, but there's a lot from different schools because number one, we want a different perspective coming in, and number two, we want the students to come up and join our students, and you know, network with them and not feel so isolated. So that's why we do that. And we have a clinical educators workshop in May that we do annually too for it's not really not just for educators, but it tends to be a lot of educators that come to get their educational methodology, which is required for CODA. So, and the laser course is taken off and the anesthesia course is still here. So I'm hoping to add nitrous, but got to do the work, you know?
exactly.
So,
All right. Well, I have one final question for you.
sure.
What advice would you give yourself at the very beginning of that you wish you knew at the very beginning of your academic career?
The very beginning. Okay. I guess the very beginning would be get that baccalaureate degree, be involved in your association right off. Don't, you know, expect that you're going to be told what to do. You got to think outside the box and realize that that dentist depends on you to be the thinker. I mean, when I got into my practice in Baltimore, my pediatric practice, that those dentists wanted me to be, what do you want to do in this area? And I was like, what? You know, I can do that. So I think my what I would have given myself advice is to go straight to a baccalaureate degree program. And I try to do that with my students now because we have an associate degree and a bachelor's degree and a degree completion and a master's. And I always say to them, the profession is changing so much and the value of your education, of that undergraduate education to become a critical thinker and to be able to say, oh, I finished undergrad. Now if I want to go to graduate school, I can. And there's just so much happening. that's what I would have told myself. Go straight to a bachelor's degree. But at the time, there weren't that many bachelor's degrees. There still aren't that many. But that's what I would have told myself. Keep going on, get more education, network, be part of your profession, be active. And and then I would have said, go to law school.
You know, I can see you doing that.
Go to law school as a young person, not as a 50-something-year-old or something like that. Not that I'm in law school or going to law school, but I think that knowledge would really have helped my profession even more. And being in graduate school was great too, because I got a lot of information there too. But that legal stuff that sometimes I don't know the answers to, and had to turn to the lobbyists, who had to turn to legal counsel, and would have been so nice to say, this is the law and this is what it says, but that's okay. Right. I'm okay. I depend on others for that.
I laugh because I could totally see you doing that.
Yeah. It would have been fun, but I should have thought of that in my 20s or 30s, because then the kids and everything for them. And, once you're a parent, everything changes because now it's for them.
Yeah.
I went to graduate school when my kids were in grade school, and it wasn't an easy thing because they're so busy and you want to be able to do everything for them. So that would be my advice. And that's why I'm trying to instill that in my young students that I have here at Fones. And I know a few from last year, I know they're thinking to go on to dental school, and I'm so excited for them because I want them to go on. And a lot of them went into the degree completion program where they changed their major while they were in school. And I'm like, all right, good, I got them. And now I've got the intro to dental hygiene, the pre-dental hygiene class. They're not even in the program yet. And I'm already saying, bachelor's degree.
That's so good.
Go on. This is what's happening. Look at this profession. Well, you know what dental therapy is? Whoa, what's that? So just so much to tell them and to empower yourself. I think that's a lot that happens with hygienists. They feel they don't have the power to do anything in practice. And I see that with the market in some states, it's saturated, and it's true. They are encumbered with, oh my gosh, they could just get rid of me and get somebody else to just do what they say. But, you never compromise your license. You never compromise your ethics. And, I always say to people, if you're not happy where you are right now, you have a paycheck, keep looking and do something else. You'll find something that fits your niche. It'll happen. But it's hard. It's hard these days. There's a lot going on in our profession. There's a lot in practice that I'm not thrilled about that's happening. Yeah. But I think that what happens is most of those people aren't involved. So they have no network. They have no support system. And I think that's the big thing. That's why I wish I could just say, join your profession, and then it just changes everything. Yeah. So, but it's hard to get it out there because everyone's so busy, That's
why so many are burnt out. They're just burnt out. And I know that when I went and I graduated. As soon as I graduated, I knew I wanted a bachelor's degree. So I wound up graduating in May and starting the program at Maryland that August.
Right.
I had another classmate of mine that decided not to continue. She got in and decided to drop out. And that was we talked later on how she wanted to continue on. Yeah. That was one of the best decisions I made. And I noticed that my mind shifted. Mm-hmm. One of the key things that stood out for me from that program was you guys really focused on empowering us that way. And when I was in school, I got an award. I didn't even think that I was even capable of being recognized for something that had to do with my education.
Right.
And I think that every time when I got my bachelor's degree and when I got my master's degree, and that kicked my butt.
Yeah. It kicked my butt too.
My last semester, I wrote Dr. Garcia and I said, I can't do this. And she was like, Jasmine, get off the ledge.
She's fantastic. I love her.
She is amazing. And I'm raising a family, my bachelor's degree, no, I didn't have any children, but my master's I did. It was so hard. It was so hard.
It was hard.
I think that is educators, which is why we put on this event, have such an important role in the decisions that the future of our profession makes.
Yep. Well, I think that exactly what you're saying happened to me too, because I felt the same way in the degree completion program. Like, oh my gosh, it changed everything I thought about my profession, everything. And it just jump-started me to be involved and to make a change and make a difference. And the master's program reinforced it also and opened up other doors and other avenues. And if it wasn't for all that, where would I be? And what would I be doing? I don't really know. But
going into some court handling a case.
Yeah, right.
Something like really hardcore.
Oh my gosh, no. I mean, I felt exactly what you said was exactly the same way I felt. And that's what put me into education, because I wanted my students to feel that way too. And I saw it happen. I saw it happen with you. I saw it. Because I remember you sat up in the back at the beginning when you were there, up in the back, and then I remember saying something to you like, Jasmine, you really should start getting involved. Next thing I'm like, where's she going? Where's she? What? Whoa! You know, like, and now I'm like, yeah, that was that quiet student up there and she, look what she's doing now, and other students too. I just, Laura, for example, and Christy, and all these students I can name off. Even here, at students, they've done things that I felt like that's my role. My role is to create leaders. That I always said. I said the role of being an educator is to create the leaders for the future, and that's my role. And that's what I really enjoy doing with teaching, with being involved in the profession, with being involved in Jacques' initiative. I mean, that was huge for me. And what the students were able to do with that interprofessional program was amazing to me.
Yeah, that just gives me chills, because I just remember when I was recommended to go be involved with MDHA, it was you.
I know. We need a membership chair, Jasmine. You make a great membership chair.
That's exactly how I got involved. And all those little things, these certain conversations, I remember with you. And I'm telling you, it just gives me chills, because you just think about the kindness and the forethought that our faculty.
Right.
I mean, you have so much on your plate. I mean, listen, before we started this, y'all, my hair was looking like this, okay? I was in clinic today, and being an educator is not easy.
No, it's not.
But that one person that you could help motivate or inspire them really makes it all worth it. I still have relationships with some of my students that have graduated.
Yes, at all. I mean, so many of them, and it's great. I mean, it's great to see what they're doing, and then I get the phone calls or emails. Could you recommend me? I want to do this. I'm like, oh, that's so great. So they've gone on to do so many great things, and to see them all on Facebook, after they graduate, I'm like, yes, you can friend me after you graduate, and I get to see all the great stuff they're doing, and I'm just so excited. And how. Situations, they, contact me, what should I do? And they do it, and they empower themselves, and then they solve it. And like, wow, it's great to know that. And again, it stems from Linda and Jackie. And I got to say, Deb Carty was one of my inspirations too, because she was president before I was. So I had that mentoring right from her. I was president-elect. She was president. I was legislative chair, then she was my legislative chair. So we mentored each other, and it was great. So even your own colleagues, like you'll find your niche at your school of your colleagues, and like-minded, forward thinking, let's move on. What could we do? How do we solve it? And sometimes it's hard. It is. I don't think people really realize how hard it is to be an educator, because, you got your summers off. And I'm like, not really. No, I don't. I mean, I'm a 12-month contract, but my faculty are, August to May, but I know they're doing work over the summer. How could you not? Yeah, you have to, because this is just what it takes. And you don't go home at 5:00 and not do anything. You go home and do more work.
Yeah.
You get those emails all the time. I mean, you're never off. Where I'm thinking, if I was in private practice, I'd treat my patients and go home. How nice. Doesn't happen in education. And I think sometimes people don't realize how hard we work, and we really do, but we love it. That's why, because I could turn around and go to private practice and have a calm, day. No, I don't want to do that. This is what I love. This is what I want to see, those leaders I want to see you take off and the light bulb go on and you just take it and fly with it. That's the joy of teaching, and I love it.
Well, I tell you, this conversation has energized me. There's no need to drink any caffeine.
Well, every time we talk, it what happened. I mean, last year when you came to our school and you came for our fall symposium. Remember the symposium? You came for that, and then you came for the board review. Remember?
Yes.
We had a Fones weekend in October. It was alumni weekend, and then you came in our board review. It's like, yeah, this is great. This is getting me jazzed. This is getting me, really going. And it's like shoe on the other foot. It's like great that my former student has gone where she's gone, and she's still going because I can't keep track of what she's doing because she keeps moving all over the place. I'm doing this, I'm doing that. And I think it's so great. But look how many you've inspired. Look how many you've inspired, And then I could turn it around. Where did you think you were going to be after graduation, So, yeah.
Changed so much.
A lot.
I never thought of any of the stuff that I've done right now.
No. I think we said it when the time we did the Mom Janice, the door opens or somebody taps you. Remember? Someone taps your shoulder. And it's true. That door opens. See what's behind it and go for it. And you've got your support system, you got Dr. Garcia, you got, me, Jackie Freed, all these people that I look to also as my mentors. And thank goodness for them. Olga Ibsen's at our school. I mean, I've got the powerhouse right there. She's amazing.
Yeah.
And she just, she sends me a text. Are you at this meeting? I'm like, well, no, I'm not at that one, but I'll be at this one. Well, who's there from Fones? So it's just great. So it's wonderful to all the people in ADHA and have been amazing. And you could tap any of them. I mean, past presidents, you send them an email. Adia, Rebecca Stolberg, she's amazing. It's amazing people that are in our profession that are there to advise, to help, to mentor. They're there. You open the door, you send them an email. That's all you have to do.
Yeah.
And I think that happened with a lot of students. They would email me, I really think I want to do industry. I want to do this. Here, why don't you email this person? See what they say. See what advice they give you.
Yeah.
So, one person tells another, and then who knows what could happen. So we've been lucky. We've been blessed. We've been very fortunate with what we've done with our professions. And I say, if anybody's feeling that I don't know what I want to do anymore, I feel like this is it for me. Tap somebody, talk to somebody who's doing some amazing things, ask questions.
Yep, absolutely. Yeah. Woo, you got it right there. You got it right there. Woo. Woo. So it's so very true. So the same thing that I tell someone that's a clinician that's burnt out, get out of the four walls of your operatory. And for someone in academia, get out of those four walls, get out and meet some people, which is why we're doing this empowerment series. So that if anyone hasn't heard of any of the work that you've done, they can listen to this and get invigorated, because there are people out there that feel the same way you do. They want more, and they just want to make a difference.
Yeah, and you could make a difference in a small way or a big way. I mean, my thesis was early childhood caries. Why? Because my pediatric practice in Baltimore City, in an affluent neighborhood, I was seeing unbelievable decay. I'm like, what's going on here? And so that was my thesis. And what happened from it, I ended up teaching, and I ended up going out into the community teaching hygienists, and that flew from something else. And then I wrote papers about it. And then interprofessional education, got interested in that. Wow, this would be great. We should make it routine and normalization of HIV testing in practice. Why not? Let's teach our students how to do it. Boom, boom, boom. We're doing it. And it's just, that's gone a long way. And that opened a lot to me of communities that I wasn't dealing with. So I got to go outside of the walls of the dental school, which was great, because I saw medicine and I saw healthcare and nursing and law and social work and the whole thing. Let's all work together and come up with a treatment plan. Wow. It's amazing. So, and you're right about that. So it's just lots of things that we don't think is a lot of hygienists don't think that they can do lots of different things, and they can. If somebody tells me that all they do is clean teeth, I don't want to hear it. No, I don't even let my students use that word. You don't say I clean teeth, because you don't. You do a lot more than that. I am not a cleaning lady, okay? I am a professional. I'm a hygienist. I'm a healthcare professional, preventive specialist in dentistry. That's me.
So I said that to my students last week. And my student told me on Friday, she said, Mrs. Haley, I told the receptionist that I was going to provide my dental hygiene services. They would like to pay for the dental hygiene services. And she was like, what? And she, oh, wait, we were told not to say cleaning anymore. And it's funny that you say that, because those little small tweaks in our language can even empower us.
Oh, yeah.
We realize how it does minimize the work that we do.
It does. I mean, all the things we do. And that's why I always say to students, tell your patients what you're doing. Tell them you're doing an oropharyngeal cancer screening right now on them. Tell them that you're checking their mouth and their throat and their face and their neck for cancer. Tell them, because guess what? They don't know what this is. They don't know what you're doing, you know, and tell them everything you're doing. Put that diploma up. Put that license up. Yes, I'm licensed. I'm boarded.
Yep.
You are? Oh, I didn't know that. You know, yeah, see, I worked hard, you know, but it's just there. It's up there on the wall, and they look at it and then they ask the questions. And, you know, why not? That's who we are. We're licensed. We're boarded. We're the only other person in that practice besides the dentist that brings money into the practice, really, right? Yep. We're so powerful that we don't understand how powerful we are to the profession of dentistry. I mean, without hygienists in that practice, where would they be? You know, I mean, thank goodness, Dr. Fones, you had a brilliant idea way back when in 1913, and it's pretty amazing what we're doing. And I just see that we're going to do much, much more if the confines of the regulations are not as tight in certain states. If we could do what really we're trained to do, wow.
Yep.
You know, all the education we have, wow, we could do so much. It's just, you know, let it go. We're not going to take over your practice. We're here to be team players. This is what we're here for. I mean, how nice is it that in Maryland now that I hear that they won't hire me unless I'm local anesthesia nitrous oxide certified? But before the whole thing happened, it's like, oh no, you can't, hygienists can't do that. Now they're like screaming for it. So that's what I think dental therapy is going to happen too. The value of that new provider is going to be so helpful that they're not going to want to work without them. And that's the hope. I mean, dental therapy, you know, is a long climb in a lot of states. I mean, it took almost 10 years in this state, or over 10 years. And it's just the same old. And I'm just tired of the same old, you know, just really, I really want to open up my own practice. Really? Not at this point, but, you know, it just makes me crazy.
I get it. I totally get it. Now, listeners, I was only supposed to be on here for about 15 minutes. This conversation is so good. It's like, I can't cut it off because it's true.
15 minutes. Oh my gosh.
Let me tell you one more thing. I know I said the last question, but when you were talking about the interprofessional program, when I was asked to come on, it was because I was volunteering my time.
Right.
And so a lot of people, when you do things because you're passionate about it and you're not necessarily getting paid, it could lead to amazing opportunities.
Oh, absolutely.
And it opened my eyes to so much. Trauma. I didn't know anything about trauma. We don't talk about that.
Nope.
But
we don't do anything like that.
Worker on our team, and I was able to help with the curriculum and then eventually get trained. That was like, it just reshaped my whole view on public health.
Oh yeah.
People.
I mean, all kinds of things that came into play with that program was amazing.
Yeah.
You know, human trafficking and things. Who was thinking about that? You know, wow. You know, and just the legal concerns and the ethical concerns and the social concerns of these clients that we were dealing with, and just it was amazing. It was amazing, and it was great experience. So yeah, you're right. I mean, I volunteered at the dental museum. That's what I did when I remember I volunteered, and that opened up other avenues.
Right. You never know.
Yeah, you never know.
Anywho, thank you. Thank you so much. I appreciate it. This was such a wonderful conversation tonight.
Thank you, Jasmine. I really enjoyed it. We had a good talk.
Yes, we did.
All right. I will talk to you soon. Have a good evening, and I'm glad I got to be part of this. It's great.
Yes, thank you. All right, bye.
Bye.